Hello everyone, good morning. My name is Radwa. I did this presentation on syphilis. So let's get started. So our agenda for today, we will get to meet our patient. We'll discuss the symptoms and any relevant history to the case. We will also talk about the physical findings, their diagnosis, and any diagnostic testing that goes along with it, as well as the treatment plan. So let's meet our patient. Our patient is TJ. He is a 31-year-old male who presents to an urgent care center with a chief complaint of, I think I am allergic to something. Prior to today, the patient states he was in his normal state of health until approximately 2 days ago when he started developing this rash that began on his stomach and is now on the palm of his hand and the sole of his feet. And there's a picture at the bottom left that I'll show you. The rash is not itchy and not painful. Upon further evaluation, he states that a couple of weeks ago he saw this strange little pimple-like thing on his penis, but it wasn't painful and it eventually went away on its own with no interventions. When asked about his sexual health, he stated that he is sexually active with 2 to 3 concurrent male partners at this time. He also had unprotected sex with at least 2 of his partners. In the past couple of weeks, he had participated in condomless intercourse and had been in a monogamous relationship during the past 6 months. He is not entirely sure about his sexual histories of his past nor his current sexual partners, and admits to at least 15 lifetime partners from what he can recall. He never got tested for HIV. He has never been vaccinated against HPV and is unsure if he ever was vaccinated with hepatitis A vaccine. For allergies, he denies any allergies to food, medications, or environmental. He denies any past medical history or any surgical history, and his childhood vaccines are up to date. Family history. His mother passed away at the age of 52 from stroke. His father is still living and has type 2 diabetes. The patient denies any medications. For social history, he did admit to alcohol and marijuana. He denies any tobacco or illicit drug use. For his physical exam, his vitals are as follows. His temperature is 101.3. His blood pressure is 140/87. Heart rate of 71. Respiratory rate of 18. And he is currently sitting at 98% on room air. He is 5'7" tall and weighs 59.5 kilograms. His general appearance. The patient is in no apparent distress. He is awake, alert, and oriented ×4, but is noted to be slightly underweight. For a clinical presentation, physical examination revealed a diffused, mucky continuous rash noted on the palms of his hands as well as the soles of his feet and abdomen area. No alopecia, human neurologic deficit, ocular or cardiovascular abnormalities were noted at this time. So syphilis is diagnosed based on how the lesions look. It's red raised scaly lesions. It's also diagnosed based on the patient's clinical presentation, as well as the progression of his signs and symptoms, as well as the lab testings. For the diagnostic testing, as we all know, syphilis is a dangerous STI. Dark field microscopy is the most specific technique for diagnosing syphilis when there's an active germ and condylolentum is present. Differential diagnosis. It would include several exams because when the patient presents to us with syphilis, we wouldn't really know unless we run several exams to do differential diagnosis because it could be many other things. The differential diagnosis would include a complete hemogram as well as ESR. It would include the liver function test, a renal function test, random blood sugar. We would also do vitamin B12 levels, just in case. We'll test for the serum HIV. We'll do radiography of the brain and the spine. We would also do the nerve conduction velocity and electromyography. We'll do the serum VDRL and a rapid plasma regime test. We would also do a TPHA test, which is a test that actually detects antibodies that are very specific to syphilis. And we would also do a cerebral spinal fluid analysis, because why not? Um, Once a patient has been diagnosed and a diagnosis of syphilis is confirmed, the healthcare practitioners is required by the law to report the disease to the Department of Health. So for the treatments, when an individual is diagnosed and treated with syphilis in its early stages, it's easy to cure. It is effectively treated with penicillin. It's the preferred actually treatment for all stages. After you've been treated for syphilis, one will have periodic blood tests and exams to make sure that the patient is responding to the usual dose of penicillin. And on an extra note, an individual should avoid all sexual contact with their partners or any new partners until the treatment is completed and a blood test indicate that the infection has been cured. One should also notify their sex partners that they have been tested, that they have been um, diagnosed with syphilis for them to get tested and get treatment if necessary. All the involved parties should also get tested for HIV. Those are my references. Thank you so much for listening. I hope you learned a lot and enjoyed my presentations. Thank you so much.